Most stroke survivors live with other chronic health conditions that can impact their recovery and well-being. Each patient outcome can be different. The goal of this study was to develop a tool using mobile technology that improves the way home-based healthcare is delivered. The result is the MIST app.
Community-based care is really critical because we know that about 80% of older adults live at home in the community, and many of these older adults will require in-home care in order to stay at home, which is really our goal. And so community-based care is typically offered by community provider agencies and by providers such as nurses, physiotherapists, occupational therapists, personal support workers, speech-language pathologists, for example. And these people go in and assess the person in their home. And the important aspect of this is that they can see the person in their own home environment, and they can tailor their activities to that individual's needs and preferences.
The research team spoke with over 40 home health care providers in order to understand the challenges they face in their work setting. They also spoke with directors of community healthcare organizations to understand these issues from a systems perspective. The team came up with a plan to build and implement a mobile health app that could be used to improve the way home health care is delivered.
We heard through our consultations a variety of ways that personal support workers, also known as PSWs, can have a larger voice within the team. And we built those into the app, into MIST. We, because the PSWs do have the most, see the client the most frequently of any of the care providers, they will have the opportunity to be able to communicate with a full circle of care, including the client and their family. Also, on each visit, built into the app is what we call the stroke safety checklist, which will prompt the PSW to go through a quick checklist that will enable them to notice if there's something that has changed with the client that needs to be reported to the rest of the healthcare team, to the regulated healthcare team. So we're very excited about this.
Mohawk College, through the IdeaWorks program and the Medic Lab here that we're sitting in, as we partnered with McMaster University on this project on a research level, but also on an applied research level where we actually developed some software technology. IdeaWorks is the department here that is responsible for working with industry and other government agencies to do industrial-facing work. Mobile technology is powerful, it's pervasive, and it's also very personal. There's very few people that share their mobile devices with other people, and it makes a direct connection between patient and a service or delivery or communication with a provider in healthcare space.
We're really excited about what MIST is going to offer the community care providers and clients in terms of communication. Finally, they'll have exactly what they're saying is their greatest challenge. They'll have real-time, secure communication with the whole circle of care for every client available at their fingertips.
The MIST app is ready for testing. A small sample group of community care staff and clients will use the app as researchers measure its usefulness, practicality, and effect on quality of care.
As a senior, I think that the availability of the app program is just wonderful for me and seniors in their latter years to have that availability of that information.